Hello everyone, now let us discuss about the anatomy of bronchi. At the superior border of the fifth thoracic vertebrae, the trachea divides into a right main bronchus. Bronchus is nothing but windpipe. Right main bronchus which goes into the right lung and left main bronchus which goes into the left lung. At the fifth thoracic vertebrae, trachea divides into right main thrombus and left main thrombus. The right main thrombus is more vertical, shorter and wider than the left. As a result, an aspirated object is more likely to enter and lodge in the right main bronchus than in the left. And like trachea, the main bronchus contains incomplete rings of cartilage and are lined by pseudostratified ciliated columnar epithelium. At the point where trachea divides into right and left main bronchus, an internal ridge called as carni is formed by a posterior and somewhat inferior projection of the last tracheal cartilage. At the point at which trachea divides into right and left bronchi, carni is formed. It is an internal ridge. The mucous membrane of the carni is one of the most sensitive areas of the entire larynx and trachea for triggering a cough reflex. And widening and distortion of the carni is a serious sign because it usually indicates a carcinoma of lymph nodes around the region where the trachea divides. That is the significance of carni. On entering the lungs, the main bronchus divides to form smaller bronchi, the lobar bronchi, one for each lobe of the lungs. On entering the lungs, the main bronchus divides to form smaller bronchi, the lobar bronchi, one for each lobe of the lung. The right lung has 3 lobes and the left lung has 2. And the lobar bronchi continue to branch, forming still smaller bronchi called segmental bronchi. First main primary bronchus, then lobar bronchi, then segmental bronchi that supply the specific bronchopulmonary segments within the lobes. The segmental bronchi then divide into bronchioles. The bronchioles in turn branch repeatedly and the smallest ones branch into even smaller tubes called as terminal bronchioles. These bronchioles contain club cells, columnar non-ciliated cells interspersed among the epithelial cells. The club cells may protect against harmful effects of inhaled toxins and carcinogens. They produce a surfactant and function as stem cells which give rise to various cells of the epithelium. The club cells may protect against harmful effects of inhaled toxins and carcinogens. And the terminal bronchioles represent the end of the conducting zone of the respiratory system. Terminal bronchioles represent the end of the conducting zone of respiratory system. This extensive branching from the trachea through the terminal bronchioles resembles an inverted tree and is commonly referred to as bronchial tree. As the branching becomes more extensive in the bronchial tree, several structural changes may be noted. As the branching becomes more extensive, several structural changes may be noted. Now coming to the structural changes, the first change will occur in the mucous membrane. The mucous membrane in the bronchial tree changes from pseudostratified ciliated columnar epithelium in the main bronchi, lobar bronchi and segmental bronchi to ciliated simple columnar epithelium with some goblet cells in larger bronchioles to ciliated simple cuboid epithelium with no goblet cells in smaller bronchioles and non-ciliated simple cuboidal epithelium in terminal bronchioles. If we recall, the ciliated epithelium of the respiratory membrane removes inhaled particles in 2 ways. The first is mucus produced by goblet cells traps the particles and cilia move the mucus and trapped particles towards the pharynx for removal. In regions where non-ciliated simple cuboidal epithelium is present, inhaled particles are removed by macrophages. Whenever ciliated epithelium is present, The mucus produced by goblet cells traps the particles and the cilia moves the mucus and trapped particles towards the pharynx for removal. And in the regions where non-ciliated simple cuboidal epithelium is present, inhaled particles are removed by macrophages. The next is plates of cartilage. The plates of cartilage gradually replace the incomplete rings of cartilage in main bronchi and finally disappear in the distal bronchioles. Plates of cartilage are replaced by rings of cartilage in the main bronchi and finally they disappear in the distal bronchioles. And next is, as the amount of the cartilage decreases, the amount of the smooth muscle increases. Smooth muscle encircles the lumen in spiral bands and helps maintain patency. However, because there is no supporting cartilage, muscle spasms can often close the airways. This is what happens during an asthma attack, which can be life-threatening situation. Because there is no cartilage, the muscle spasms can often close off the airways. And next point is, during exercise, the activity in the sympathetic division of the autonomic nervous system increases and adrenal medulla releases hormones epinephrine and norepinephrine. Both of these events cause relaxation of smooth muscle in the bronchioles, which dilates the airways. Epinephrine and norepinephrine, they cause relaxation of the smooth muscles in the bronchioles, which dilates the airways. Because air reaches the alveoli more quickly, lung ventilation improves. The next is the parasympathetic division of ANS and mediators of allergic reactions such as histamine have the opposite effect. They cause contraction of bronchial smooth muscle, which results in the constriction of distal bronchioles. Here you can see this is the trachea, and at the level of fifth thoracic vertebrae, the trachea divides into right main bronchus and left main bronchus. Trachea, main bronchus. Main bronchus again divides into lobar bronchi. This lobar bronchi divides into segmental bronchi, and this segmental bronchi divides into bronchioles, and finally bronchioles divide into terminal bronchioles. Here you can see this is the right lung. It has 3 lobes, 1, 2, 3, and the left lung has only 2 lobes. This is the diaphragm.